So stem cell transplantation has been a part of treatment of AL amyloidosis for a long time now. It's one of the key treatments, and now that we have newer treatments like daratumumab, bortezomib, and other therapies, the question always comes up, should all patients get a stem cell transplant in AL amyloidosis if they're eligible, or can we defer it in some patients, especially if they're having a good response early on? Now, remember, about a fourth of patients with AL amyloidosis are transplantation eligible, and the majority are not. So, in this study, me and my colleagues at Mayo Clinic, we looked at patients who collected stem cells. So, they were considered eligible for transplantation by their treating physician. And they collected stem cells over a course of 14 years, from 2004 to 2018. And then we divided the group into two categories: patients who underwent an early transplant, that is within 90 days of collecting stem cells, and those who deferred a stem cell transplant right now, that is, who underwent a transplant after 90 days or who are still undergoing follow up and have not undergone a transplant. And essentially, what we found was, at least for overall survival in this population of patients, there was no difference in patients who underwent an early transplant versus deferred a transplant. Now, majority of these patients had achieved a very good hematologic response with initial therapy. And when we look at the subcategory of patients who at least achieved a VGPR, which is a very good partial response after initial therapy, there was a slight trend towards improved outcomes with early transplant, but the median overall survival was 14 years versus 13 years. So not a staggering difference, but I think what is very encouraging to see is that the median overall survival was that long, like 14 and 13 years. So I think it's very encouraging for our patients. And my takeaway is that when patients are eligible for transplant, our first goal is, of course, to achieve a deep response. We try to do that by using induction therapy. And once they have achieved a deep response, we always collect stem cells in those patients. And ideally, yes, we should try to take them to a stem cell transplant at that point. But it would be reasonable to defer it until a later point as long as they've achieved a good response and follow them closely. And that can then be utilized at the time of relapse. So I think overall, a very good message for our patients that they can do well with either strategy as long as they've achieved a deep response.